Illinois Stories is brought to you by the Corporation for Public Broadcasting and by the support of viewers like you. Thank you.
Hello, welcome to Illinois Stories. I'm Mark McDonald in Quincy at Blessing Hospital in front of the soon-to-be-open Moorman Pavilion, the biggest project Blessing has ever taken on. This 170,000-foot addition worth $70 million will be open soon. Well, Maureen, these floors haven't even been walked on yet, have they?
Not yet. We're going to be the first few folks to dirty these floors up as we tour the building today.
I think you told me that this has been in the planning stage since 2002, and you have been in on those plans all that time, haven't you?
All that time. I said the longest pregnancy known to man here, trying to get this building birthed.
Wow, I bet you can't wait to get this thing inhabited.
Absolutely. Yeah. Absolutely. And we're probably weeks away from getting in here. One big step left is a state inspection. Mm-hmm. Once they finish that, we can then move into the building.
We're talking about something in the neighborhood of 170,000 square feet.
Yes, you are.
Now, Blessing is a big health system, but that's a big addition even for Blessing, isn't it?
This is a big addition for us, and probably the biggest building project we've had in the last 20-some years. Mm-hmm. When you look at it, it was a $70 million project. We're coming in under that number, but that was what the budget was built on. And that project, this project here today, 70% of the work went to local contractors. Mm-hmm. So we were very much committed to working with the community and building this building. Keeping
the money right at home, huh?
And it was designed to improve the efficiencies of our own building, because we're moving our behavioral health services down from the 14th Street campus to the main campus. Mm-hmm. And that brings efficiencies in daily operations that'll probably be equal to about $1 million a year for us.
So you spend 70, but you keep saving in the process. Pretty soon, I guess it pays off, doesn't it? For itself?
It does. Mm-hmm. It does.
This is really a neat addition right here. You can see what you've tried to do. You use the space in a most imaginative way. You've got the history of Quincy on the wall here.
We do, and this was a phenomenal partnership with the Historical Society, with all of the media outlets in our community, really trying to tell the story of Quincy and of Blessing at the same time, because you can see we snuck in here at 1875, so we go all the way back to 1818.
And here we're looking where you sneak in, and
right.
Founded by lay women, right? The Blessing system.
This is amazing, and they had a board of lady managers that got put together. We've had a school of nursing here in this community for a long, long time, and the school today continues to grow.
Now, during this program, we're going to get the overview from you. There's going to be psych wards for children and adults in this area. There's a brand new cafeteria in this area. There's going to be 52 new personal rooms.
Absolutely, new private rooms.
So you have arranged for people to give us a tour of this place.
Absolutely, you'll get to meet some of the team who worked on this project along with me all of this time.
Terrific. But like you said, what this will allow you to do is take some of the less efficient ways that you were operating in the old building and renovate, bring everything up to date.
Absolutely.
Healthcare is not the way it used to be.
It has changed tremendously. You know, I can remember when I had my first child, I spent 5 days in the hospital. Today we have moms going home in 24 hours, 48 hours after they deliver. We have improved what we're doing and have found ways to improve the recovery back in your own home. And most of us are much more comfortable in our own home.
Sure.
It's our own germs that we live with every day in our own home.
Well, you know, you talk about germs, and people take this very seriously. A lot of people think that the best place to get sick is in the hospital. So, well, they do. They do think that. It may not be true, but they think that. But one thing you can do is by making these private rooms that you're talking about, you do keep the traffic down and you keep people from coming into contact with each other, and it does help, doesn't it?
Absolutely. When you look at a semi-private room today, you've got a roommate, but you also have their family and friends visiting them. And every surface that people touch when they come into a hospital. We hope that we've taught everybody about good hand washing, cover your nose and mouth when you're sneezing and coughing. but we forget. We're human. And then all of these surfaces are touched, and there are germs there, and they just pass on.
Mm-hmm. As you come in, there's several ways to come in. We came in one of the main entrances. There would be two main entrances. But what you'd want to do is you'd want to find your way to the elevator so you could go either up or down to where
Correct.
your destination is. And what you've done here is your decorations are just gorgeous. These are local photographers have taken these pictures?
Correct. Local artists have put the artwork together that is in this pavilion. And each one of the floors, as you get off the lobby area, has a different theme. And it is all about the Midwest and our region. So that you can know, hey, I got on here at the farm and there's the river. And it gives everybody an opportunity to really even look in the picture. And you can see different things in the photo. And you know, we're a very proud Midwestern facility here. Proud of our roots, our heritage, and really value the industry that's in our community.
This new addition is also going to allow you. We mentioned moving some of the activities here because it'll end up consolidating and saving you money.
Absolutely.
Some of your facilities are just flat old, right? And some
They
of them
are.
need to go.
They absolutely do. And part of our strategic planning and really making sure our facilities are planned well is to preserve the buildings that need to be preserved, make sure that our work that we design and develop is done in the most efficient way, that it doesn't become expensive to run and operate. And you know, some of the older buildings, harder to maintain today. And today we can build these new buildings, and as you'll tour this one, you'll see what we've done in energy savings with lighting. We've even thought about how the lights hit patients. And as they're lying looking up at the ceiling, making sure that they don't have bright lights gazing into their eyes. But a lot of safety features that we'll touch on as we go through the rooms today.
Maureen, thank you. I'm looking forward to your folks giving us the tour. Thank you very much.
You're quite welcome. We're proud to have you here with us today.
Well, you guys have a lot to be proud of, I'll tell you that.
I will tell you, as I said, this has been a long project in process, and it really has culminated with the community being engaged with us. I mean, people would come and watch construction. It was just an interesting process. So here we are.
We are.
We are at the stage. We're ready to cut the ribbon and move on in.
All right. Well, Jerry Jackson, you're the supervisor on this addition, as you are on most of the projects here at Blessing. This was major, wasn't it? This was a huge project.
Certainly the largest project I've had the opportunity in my 30 years to work on within the Blessing Health System.
Yeah.
Absolutely.
And it started, Maureen said it started in 2002. At that point, you were trying to figure out how this was going to match up with the Cancer Center and the other new additions that you all were planning at the time. So it doesn't happen quickly, does it?
Oh, no. And that's the one great thing about our board and our senior leadership. They always have a vision in front of them. So this is a culmination, you know, after 13 years of a vision that was established with our board back in 2002, which is pretty amazing. If you'd look at the documents that were presented at that time, it really does look like what we had envisioned at that time.
Describe to us what we are looking at. I know we're looking at 5 stories of new space, but how will it be utilized?
Okay, well, the 5 stories that you mentioned, the lower 2 levels of that are part of our inpatient mental health program. In addition to that, there's an infusion center on the lower level.
Now, what is that for people who don't know what an infusion center is?
Well, we do a couple of things there. That would be for chemo patients to receive their chemotherapy, and then for blood and transfusions. So 2 different types of patients would visit that area. And then the next 2 levels are what we call med-surg inpatient areas, and they align with our 2nd and 3rd floors of med-surg within the existing patient tower. And then the 5th elevation of the building is actually a shelled space for future expansion. What most people don't realize in this building, though, below that lower level is actually almost a 2.5-story deep sub-basement that houses all the mechanical and electrical services for the building.
Now, if we were to get a chance to actually look at the construction process as it was going on, go through what you went through those years while this was being built. What was it like watching this thing go up?
Well, the first thing we obviously have to do is identify a partner to help us through the design process. And we've had a long-term relationship with a company in St. Louis called Krishner Incorporated. The founding member of that company is actually from Quincy, Illinois. So there's a long history, a lot of ties there, and they've done a lot of great work for us over the last several years. So once we had established that partner, one of the things that we have found that has worked very well for the organization over the years is selecting a construction management firm up front. That way we can have a partnership between us as the owners, the design team, as well as the end construction design team. Having them at the table while we're in the design process, we think brings a lot of intellect to the process, as well as a lot of cost efficiencies, because they ultimately know the constructability of these projects and what's going to be the most cost-effective way to build them. So identifying those two partners up front was very key to this. It also helps us through the budgeting process, so we don't have a lot of surprises at the very end of the project when you have somebody that's very integral to the construction process helping you establish budget benchmarks along the way.
And so from the time that you broke ground on the pavilion till this day when it's about ready to open, what time frame are we talking
about 2.5 years.
2.5 years. Is that fast or slow?
It's what we had projected. We actually, it was a little longer from the standpoint that our intent was to be done in December of 2014, and we extended that timeline by 2 months. So we didn't miss it by a lot, but we had some weather issues. If you recall, last winter was one tough,
long winter.
It was one long winter. And so we didn't get the building enclosed quite as quickly as we would have liked to. And so that did cause us a little bit of a challenge in meeting our original schedule.
But it's here now.
It's here now, and we're thrilled.
Thank you, Jerry. Mike Van Steel, your name tag here says RN real big. In fact, this is your 33rd, and today is your 33rd anniversary at Blessing Hospital.
Yes, it is.
And you've done a lot of things, haven't you?
I have done a lot of things.
You've been a nurse, and you've done a lot of planning as well.
I really have done a lot of planning, and this is kind of the end of all that planning that I've been working on for many, many years. And I'm so excited to finally see this open and be able to provide such great patient care to our community in which we serve. So
we're in one of those. We were talking about the private, the private new rooms, and we're in one right now. They've changed over the years, haven't they? All the planning makes sense.
Oh yes, absolutely. And we have spent a lot of time planning, and we've involved the patients, we've involved the family, we've involved the nurses, and we've involved all of the caregivers in that planning process, to the point of we started this many years ago when we sat down and we talked to the nurses, we talked to the patients, we asked them, what do you want in a room? What do you need to do to provide the best care possible to the patients and make it very comfortable for them? Then we took it the next step. We actually built a mock-up of that room in cardboard, brought in pieces of equipment, brought in healthcare workers, asked them to walk around in the space, see what it feels like, see what it feels like to move around, how freely can you do that. Got a lot of feedback, made a lot of changes after that.
A nurse is going to love this, because when you come in to take care of a patient, you got to have a place to work.
Absolutely.
And this is, I've never seen this in a room before, where you get a place for your supplies, you've got your sink, you can actually get set up and then do what you need to do, right?
Absolutely. This is one of the things that we're most proud of, as far as helping to make it efficient for the nurse and the caregiver and still make it very easy to deliver that care to the patient. And when we've designed these rooms, we've set it up to provide an area for the nurse, an area for the patient, and an area for the patient's family, because we know they're equally important in that plan. So when you look at this area, it's all set up so all of their supplies can easily be accessed simply by opening up a drawer, getting linen simply by opening up a cabinet. They have an area here to work with. They have a way to safely dispose of their biohazard materials, places to wash their hands, and probably one of the unique features that you're not going to see in a lot of hospitals is something we specifically came up here, and that's our way to get medications to the patient's bedside. Outside in the hallways, if you look, there's little doors out there, and the pharmacy will bring up the medications. They'll put them in a cabinet on the outside, and the nurse with their specialized key can come in here, open up the door, and access and get those medications right here at the patient's bedside. So it makes it great.
There's the patient's bedside right here. So what we're going to do is we're going to take the patient care here. I'm particularly enthused about what you've done for the family over here, because this whole little area here, it's like a little suite, like a mini suite.
It is, because family likes to be here. They like to be present and like to stay with the patient while they're here. So when you look at this is something that we found it was going to be really supportive of that. It allows both sides to be a recliner that pops out if we need it to. You can have it as a sofa if you have a lot of people here. If you just have a couple people and you need a place to work or to eat, pops up just like that as a table, so they can sit there, work with their laptop or eat. And then when it comes to nighttime, it's time to go to bed. With a simple, easy push of a button, comes over, turns right there into a bed. So
there
it's
you
as
go.
easy
You spend
as
the night
that.
with your loved one.
You spend your night with your loved one, and it's actually pretty comfortable too to sit on. So, which is really great.
Thank you, Mike. Ryan Collins, performance excellence is a term that I'm not real familiar with in the hospital business, but I guess if you were to boil down what you do is you try to make sure that the facilities are performing at their utmost, and part of that is in the planning, like in a new facility like this, I guess.
That's correct, yeah. Performance excellence is a combination of our process improvement, project management, and quality management departments within the hospital. We call ourselves performance excellence.
We're on the ground floor, the ground level of the new Moorman Pavilion, which is going to be the child and adolescent psych.
That's correct.
Area. Okay, and we're in one of the rooms. Many of the rooms look just like this, right? This is a double occupancy room.
All the rooms are very similar in design. They all have the same design features and the same basic layout, and some might be mirror images, just depending where they're physically located on this floor. But yeah, that's correct. They're all essentially the same.
When you plan this kind of a facility, particularly in a psych ward, you have to be very careful that the people that are going to be staying in here can't hurt themselves, because a lot of them are wont to do that.
That's correct.
So everything is designed differently, isn't it? Point some of these features out to us.
Yeah, absolutely. The safety of the patients and the staff, for that matter, is of utmost importance for us. And every design feature in here is either dictated by regulation or code, or by best practice. And we did a lot of work with some design teams and some architects and some specialists in the field, and learning best practices of other existing psychiatric facilities, and a lot of those you can see. An example here, this happens to be one of our, we'll call it it's almost like a closet where the patients can store their,
but
store their personal items.
Shelf out.
You can't pull that out. That's permanently in there.
Used to either swing it at yourself or somebody else.
Right, and then, for example, you see the mirrors here. The mirrors are a polished metal, polished aluminum, as opposed to having some type of glass or a mirror that could be broken. You can see all of the fixtures down here are tamper-proof. They've got covers over top of the drains, so you can't get at them. Beds, for example, are bolted.
The beds don't move, and they're bolted to the floor.
Those are all bolted down.
I assume that's true. That nightstand too. That probably doesn't move.
Absolutely, that's bolted to the wall there.
And the chair. Look out here. You've got a play area out there. What is it, a basketball court?
We're pretty excited about that. We have an outdoor play area, which is a fantastic addition for a psychiatric facility. This would allow our patients the ability to go outside in a controlled environment, get some fresh air, do some activities. It's actually designed as a basketball court, but it also has a volleyball net in there as well. And by all means, they could play other games and activities. So it's a fantastic addition that we don't currently have at our existing facility.
Yeah.
At least not to this extent.
Yeah. And of course, now you'll have room here for about 15 young individuals here.
15 total patients. This happens to be what we call a double occupancy room, so we can, if needed, have 2 patients in here. We do have single occupancy rooms in this facility as well, and on this unit. So.
And on this unit, you also have, like, in addition to the play area out there, you've also got like community areas, activity areas, and I guess therapy areas as well.
We do. We have activity rooms and day rooms, and the activity rooms are just as they sound for activities. There's a lot of arts and crafts, activities, games, things like that. We also have day rooms where the children on this unit in particular spend a majority of their time, and that's where they'll go to school, get their classes, they'll have tutors, they may have group therapy sessions, etc. It's a great place for them to kind of get together and spend the time.
Pat Gervler, now, you run the foundation that was charged with raising money for this project. You can't do anything without raising money. And you started, what, 3 years ago? That's a pretty quick route to raise the $70 million you needed to put this thing together. That's pretty fast work.
Yeah, the campaign actually kicked off unofficially in July of 2012 when we started the feasibility study.
And it's named after it's called the Moorman Pavilion.
Yes.
And there's a Quincy Foundation named after the Moorman family, right?
Correct.
And they were one of your major donors.
Yes, the Moorman family, the Moorman Foundation, is a long-term supporter of the health system. So this was a way to honor all of the things that they've done, not only for this project, but the long-term history that we've had with the Moorman organization.
But they didn't by any means do it by themselves. I mean, there were a lot of people involved in this.
Yes, yes. There was a lot of other donors that gave to it and a lot of people that worked on the campaign.
What's it like in a small city like Quincy trying to raise that kind of money? How do you get started?
Well, you really, what we started out with was we said we needed to do a study. So we looked at somebody that had expertise in fundraising. So we had an organization that we asked, a firm that helped us with that. So we asked about 80 people that were friends of the organization, community leaders. We asked politicians, business people, volunteers, employees, and we interviewed 80 people and we said, here's what we're thinking about doing. We're looking at a campaign. Here's our message. What do you think? Would you serve on a campaign? Would you be willing to give? Do you think this makes sense? Do you think the community would support it? So once that feasibility study was done, we as a group said, okay, let's sit down and look at the results, and then we made the decision that yes, a campaign makes sense.
It is feasible.
Yes.
It is feasible. We can do this. And of course, you started by, these are some of the printing materials, and it's very, very attractive the way you did it. Building for the future, and you know, just let people dive right in. Why us? Why now? A little bit about the history of blessing, and then, you know, these private single bed rooms, the gold standard in hospital care, and that's the way it's going, isn't it? That's the way healthcare is going, into single private rooms, and you're going to add 52 of them here.
Yes, yes. Yeah. There's a lot of reasons for a single bedded room, but it really comes down to patient safety. At the end of the day, people are spending less time in the hospital. Their care is concentrated when they come in, so they need that privacy. There's a lot of education that has to go on, and there's a lot of reasons why people need to be in a single-bedded room. Infection control, and just all the things around medical privacy. So we listed that out for our donors and for our community. We told that story. Here's 10 or 15 reasons why this makes sense. This is the gold standard. And people are making a choice when it comes to their health care. And we had people who told us, we love your organization, but when I'm in the hospital, I don't want to spend my time with a roommate. So they chose another healthcare organization. So this is also important for people in convincing them that they need to stay local when it comes to their health care.
Well, apparently you told that story very convincingly because enough people came up and donated to make it possible.
Yes.
Thank you, Pat.
You bet.
Lori Wilkie, we've heard the term infusion center used in this story. And I didn't know what an infusion center was. In fact, a lot of patients would come in here, outpatients would come in here because they need blood transfusions or they need chemotherapy or they need some kind of an IV system put in. And that's what happens here, I guess.
Yes, absolutely. Patient may go to their doctor, they may be dehydrated and they need to have fluids. That's another reason why we would give infusion to the patient. And
let's just step out here so we can get a kind of a wide range look at this, because this is so much different than the facility you're presently in. When the one you're in now, patients are sort of looking at each other, aren't they?
They are. Actually, we do, you know, the best that we can with what we have, but what we're using right now is a patient room. It has 4 chairs that are, you know, all sort of together. They're nice and cozy in there. We do the best that we can with, you know, privacy, obviously, and just helping the patients get through the day.
But you can see that you've got lots of facility here for patients.
Yes.
They each have a little cubicle that's somewhat private. And these chairs are going to be replaced with massage and heated chairs, so they'll be very comfortable while they're getting their infusion. And there's room, if they want, there's room for their family to sit with them?
Yes, absolutely. Upstairs right now where they're at, there are only 4 chairs. There are 7 private bays in our new space, and then actually 1 bedded room also. So if we have a patient that's just not feeling well, we can absolutely just put them in the bed.
Nice. And we mentioned a little bit of privacy. Show us how this works.
Yes, this is great because, you know, patients, if they don't know each other very well or they want to talk to their loved one in private, we can just pull out this panel and they can then have the privacy that they want. However, some of our patients come back weekly, monthly, so they get to know each other too. So if
they might want to chat.
Yeah, so if they do want to chat with their neighbor,
see,
they can do that as well.
I see. And it's interesting because this is opaque and the window from the main lobby is opaque. So there's a lot of privacy here, which makes people feel good.
Right. By design, they helped us with this because we have so much of the natural light coming in from the atrium. So we wanted to keep it nice and bright and airy, but yet obviously respect the privacy of our patients.
You'll be able to accommodate twice, 3 times as many patients as you could before.
Absolutely. And you know, we'll be here to accommodate the patients. We'll be working early in the morning until late into the evening, 7 days a week for our patients. So
thank you, Lori.
yes, thank you.
By the time this story airs, the staff will have had an open house. The public will have seen this in an open house. And all that awaits is for the Illinois Department of Public Health to give final approval. With another Illinois story in Quincy, I'm Mark McDonald. Thanks for watching.
Illinois Stories is brought to you by the Corporation for Public Broadcasting and by the support of viewers like you. Thank you. For a DVD copy of the program you've just seen, send $19.95 to Network Knowledge, P.O. Box 6248, Springfield, Illinois 62708. Be sure to include the program name, subject, and when the program aired. You can also order with your credit card by calling 800-232-3605.